Hey gang, welcome to another episode. So today we're going to talk about the 5 biggest mistakes I see people have after rotator cuff repair, after generalized surgery, whether it's rotator cuff, it could be a reverse total shoulder, slap repair, it could be anything, right? These are the 5 most common mistakes. To reiterate mistakes, I thought I would show you this. This is my mistake. So if you were around in the last video, we had a video on Goutillier scores and muscle about the rotator cuff. And so I made this drawing. What I didn't realize is that when I was making this drawing on the whiteboard, that I used this, the Sharpie. The Sharpie doesn't do very well on the whiteboard. Actually, it does great on the whiteboard. It just doesn't come off very well on the whiteboard. So I'm going to, in the next, I don't know, week or two, try to figure out how to get this blue stuff off. But that's a mistake, right? That's a mistake, my mistake. I was not paying attention. I was using what was down here. And oh well, now I have a permanent Sharpie mark on my whiteboard. Let's talk about the mistakes that I see most commonly after rotator cuff repair or other shoulder surgery. One is too fast or too slow, right? So I have this common problem, and it's actually probably pretty equal, although probably too slow is a little bit more than too fast. We give them instructions what they should do, and although they have the instructions, they see the instructions, they decide the instructions don't exactly apply to them, and so they just don't move at all. They say, well, I wasn't sure, I didn't know, so I just didn't move. Too slow is a big problem because if you get stiff, it's a much longer, harder recovery to try to get the muscle and tendon back and the main range of motion back if you start off stiff, especially if you're stiff before surgery. Too fast is a problem too. Too fast, again, people, I've had several people, and I don't really know why this is, and actually seemed to happen more recently. We do what's called a biceps tenodesis, and if you see episodes, all about biceps tenodesis, release the biceps inside the joint, and then make a little incision here and reattach it out there. So when you do biceps tenodesis, you have to be careful. You can't load the biceps. If you load the biceps, what do you think might happen? Well, it'll pull that biceps tenodesis apart. So I've had a few people who decided they were gonna lift a table or lift something heavy, and they come in and they say, oh, I felt a pop and now I have this weird position. What happened? Well, you went too fast. You're not supposed to be lifting stuff right after surgery. So too fast, too slow. Try to be in the middle, and if you don't know where the middle is, ask your surgeon. They'll help you. They'll tell you what you should and shouldn't be doing. Number 2, you get behind. Specifically in the very beginning, you get behind on pain medicine, right? And so I know people are really super freaked out about narcotics, and I get it. I don't like narcotics either. However, they are an unnecessary evil often after shoulder surgery. Shoulder surgery hurts a lot. And it might be okay the first night if you get a good block, the injection numbs your arm up, you don't have any pain. You're like, I'm not taking the pain medicine before I go to sleep. I don't hurt. Well, then you wake up at 3 o'clock in the morning, 4 o'clock in the morning, and you want to scream because you're in so much pain. And then it's hard to get caught up after that. Even you might start taking your pain medicine, but the pain medicine takes a while to get in your system. And so if you get behind on pain, oftentimes that makes the first few days miserable. And hopefully not more than that, but that's not a way to start your recovery from shoulder surgery. So don't get behind on pain. So 3, ice. People, for some reason, are concerned that if you ice it, there's decreased inflammation. If there's decreased inflammation, there's decreased healing. I don't know quite where that comes from. Conceptually, I get the idea, but really and truly, right in the beginning of our recovery, our healing, what we're trying to do is decrease the inflammatory response because we get a robust inflammatory response, which is good in some ways. However, it really, really hurts. That's why it really, really hurts. And so we want to make sure that you're icing it because it's going to make you feel better. The inflammation will be less swollen. Yeah, a little bit, but it's not really so much about swelling. It's really more about pain control. So make sure you're icing. 4, compare. Comparing is dangerous in all of life, philosophically, right? But specifically in rotator cuff repair. And you go to the therapy, you've recovered for a couple weeks, you go to therapy and you see this guy going like this, moving it. How long has it been since surgery? And they say 3 weeks, and you go, oh my gosh, how in the world? I'm way behind. I better get going. Resist the temptation to compare because everybody's journey is different. They might have just had a decompression, a cleanup, and not a repair. They might have had a small repair, you might have had a big repair. They might have had a subacromial decompression and you might have had a biceps tenodesis. So it's really impossible to compare. And it's not helpful for anybody. I mean, a little motivation, maybe. What I would do is I wouldn't compare. I'd talk to your therapist and your doctor. Say, how am I doing, right? That's really the way you know, because they know. Therapists, maybe, depending on how much information they get from your doctor. But certainly the physician knows, the surgeon knows what it was like in there, what to expect. Should you be going faster? Should you be going slower? Should you compare yourself to a small rotator cuff repair or just a subacromial decompression? Or should you compare yourself to a Bankart, right? So all those have different recovery patterns, and we need to not compare. We need to just do our best of what we're doing and make sure we're doing what we're asked to do, not more, not less. And lastly, the timing. We talked about this last time about Goutillier description and grading of rotator cuff tears, and specifically of muscle. If you have a traumatic rotator cuff tear, you really shouldn't wait very long to get it done, get the surgery done, get it fixed. Atraumatic or long-term, no specific injury, just pain coming over time is probably less important, and that's questionable too, actually. But if you have a traumatic repair, a traumatic tear rotator cuff, don't wait too long. We have a video about how long you should wait as well, and we'll link that in the show notes too. The key thing, timing. We want to make sure we can fix it before it gets too big or before it gets too atrophied. Because if it's really big and really atrophied, the results are not going to be as good. So those are the 5 mistakes that I see day in, day out in my practice. So please like this video. Please subscribe to the channel. Please click the bell so you're going to actually get notified when the next video is, because that's super important. Please send any comments below and we'll talk to you soon.